During our normal routine in the hospital, we meet conditions that sometimes we feel that we should discuss with you in terms of a video. Today, I'm going to discuss with you pain while having sex in women. In the next video, I will also tackle pain while having sex in men. And this is medically known as dyspareunia, and it is affecting most of the women in our general population. If you like this video, please hit the notification bell for more videos that I may post, and stay with me until the end of this video as we discuss this important topic. Dyspareunia, or pain while having sex, can be either into the vagina or deeper into the pelvis, and we are going to tackle causes of pain while having sex at the vagina. Number one cause is infection, and infection can range from urinary tract infection and sexually transmitted infection. I had discussed about urinary tract infection in my previous video, and kindly watch the video that appears up here about urinary tract infections. Sexually transmitted infections can be gonorrhea, chlamydia, or even genital herpes can bring pain while having sexual intercourse. Lack of sexual arousal at any age can also result into pain while having sex, simply because there are some individual men who do not prepare their women in advance, or they do not make their women to be in the moods of having coitus. The vagina should be prepared, there should be lubrication so that there will be no friction. If the vagina is not well lubricated with the vaginal fluids caused by sexual arousal, the vagina will be dry and friction will occur, and this will lead to bruises, and a woman will automatically feel pain. So this is a challenge to our fellow men, that if you want to have coitus with any woman, kindly make the woman to be in the moods, so that even if you are doing sex, the woman is very, very comfortable and she enjoys this until she reaches vaginismus. Is also a condition that normally make sex impossible and even painful due to muscle contraction, persistent muscle contractions around the vagina, making the vagina to shut, and penetration is impossible or difficult or even painful. When these muscles are contracting and relaxing, it may bring this particular condition called vaginismus. And when they contract, penetration normally is impossible, and there is intense pain, and a woman is not willing, and even the moods of having sexual intercourse, even the fear of having sex, come to this particular woman. And if you are not careful, this woman can fear having coitus forever. So we have primary and secondary vaginismus. Primary vaginismus, women normally describe it as pain like somebody hitting the wall. Now, this is a situation whereby a woman is having pain whenever anything is inserted into the vagina. And number one thing that can be inserted into the vagina is penis, and also those women who normally like douching their vagina or washing their vagina with douches, vinegar, acids, types of acids. I don't know how they do it. This one normally causes intense pain. So primary vaginismus is when something is being inserted into the vagina, there is intense pain and making insertion of the penis to be very difficult or even impossible. We normally refer this as lifelong vaginismus. Secondary vaginismus, or what we call acquired vaginismus, is whereby a woman had had sex before, but now there is difficulty in penetration associated with pain, and a woman is not even comfortable to continue having sexual intercourse. This is called acquired vaginismus. So vaginismus can affect a woman in terms of fear of having sexual intercourse, even previous history of having been defiled or raped can bring vaginismus, and this one can make a woman not even reach the peak of orgasm. Even trying, she can't because of the fear of pain. Genital irritation is also another cause of pain while having sex, and it can range from the use of speculum during examination in the hospital, or even spermicides, or even latex condom, and also women who are dodging their vagina, washing their vagina with different kinds of soaps, normally irritate the vagina, and this one results into pain while having sex. Age is also a factor, and it entails menopause, that is 45 years and above. The hormones are reducing, and this one normally makes the vagina to be dry and causes pain while having sex. Vaginal injuries caused by defilement or rape, or even during delivery, that is when you have episiotomy or you have tear, you can have pain while having sex, particularly when the healing has delayed, or you involve yourself into sex when you have not completely healed. So when you have delivered, kindly take your time until that tear or the episiotomy will heal, is when you can now practice sexual intercourse. Vulvodynia, this is a chronic pain on external genitalia of the female affecting the vulva, and this pain is not having a very specific cause. In fact, it is an unexplained pain affecting the external genitalia of the woman, and it's normally characterized by vaginal dryness, inflammation, or even itchiness. This is not due to bacterial infection, it is not due to candidiasis, it's not due to trauma, it's not due to vaginismus. In fact, its cause is unexplained, and we will talk about this in management of vulvodynia when we will be tackling management. So this is a very other cause of pain while having pain at the pelvis. Now we are going to consider the human anatomy of the genitalia, particularly of the female. And if you look at the uterus, there can be uterine fibroids, there can be endometriosis, good fallopian tube, you can have ectopic pregnancy, even at the cervix you might have cervical polyps or cervical cancer as a cause of pain deeper into the pelvis. Irritable bowel syndrome is another cause. Also, constipation can also cause pain deeper at the pelvis when you are having sexual intercourse. Not forgetting pelvic inflammatory diseases that encompasses of STIs, and I've mentioned earlier about gonorrhea, syphilis, and chlamydia coupled with genital herpes. Ovarian cyst or ovarian masses that we'll tackle in one of the videos to come in details is also one of the causes of pain while having sex. Dyspareunia management is case by case, and of course we will do laboratory investigations to rule out any infections like gonorrhea, syphilis, or even chlamydia, genital herpes. And we will also do psychosocial support so that we inform our men to be preparing their women to enable them to be sexually aroused before performing any sexual intercourse. Kegel's exercise is also very important. These are the use of the muscles that you normally use to stop urine coming out abruptly. So those muscles, when you do the Kegel exercise, it will help you to relax the muscles and prevent particularly the issue of vaginismus. Then there are cone-shaped objects that we normally teach women how to slightly insert into their vagina to make it comfortable during sex. Even the use of your fingers is also allowed to help you to insert every day so that you can make the vagina to be used to penis. And this one is having a lot of difficulty in some women, but those who are cooperating, they are normally taught how to use this cone-shaped object and even how to use their fingers. In cases of uterine fibroids, ovarian cysts, endometriosis, they will be managed case by case. Of course, you will be sent for ultrasound, that is pelvic scan or obstetric scan, to rule out whether you have any of the above that I've mentioned earlier. And again, in the scenario where we get that you have uterine fibroids, or you have endometriosis, or even ovarian cyst, or ectopic pregnancy, they will be managed case by case to help this particular woman to overcome this idea of pain while having sex. If you like this video, please hit the notification bell, rate and subscribe for more videos that I will post, and also watch the videos that are appearing besides. Muchas